Imagine this. You're sitting at home watching TV when you suddenly feel a strange pressure in your chest. It'll probably go away, you tell yourself. Maybe it's just heartburn. Maybe you pulled a muscle. So you ignore it. Hours later, you're rushed to the emergency room. Unfortunately, this happens to thousands of people every single day. The scary part is that heart attacks don't always happen without warning. In many cases, your body sends signals long before permanent damage occurs. The problem is that most people don't recognize these warning signs, or they mistake them for something harmless. Today, I'm going to show you 7 warning signs of a heart attack you should never ignore. Some of these symptoms may surprise you because they don't always involve severe chest pain. Let's begin. Number 1. Chest pain or pressure. This is the most common symptom of a heart attack. But here's something many people don't know. Heart attack pain isn't always a sharp pain. Many people describe it as a heavy weight pressing on their chest. Others say it feels like squeezing, tightness, burning, or simply an uncomfortable pressure that refuses to go away. Some even compare it to having an elephant sitting on their chest. The discomfort usually occurs in the center of the chest, although it can sometimes be slightly to the left. It may last several minutes, disappear, then come back again. That's why many people delay seeking medical attention. They assume that because the pain disappeared, everything is fine. Unfortunately, that's not always true. The pain occurs because part of the heart muscle isn't receiving enough oxygen-rich blood. Without enough oxygen, the heart begins to struggle. The longer this continues, the greater the damage becomes. Here's another important point. Not everyone experiences severe chest pain. Women, older adults, and people with diabetes may only experience mild chest discomfort or pressure. If chest pressure appears suddenly and doesn't have an obvious explanation, never ignore it. It could save your life. Number 2. Pain that spreads. One of the unique features of heart attack pain is that it doesn't always stay in one place. Instead, the pain can travel. It may spread into the left arm, both arms, the shoulders, the neck, the jaw, or even the upper back. But why does this happen? Your heart and these parts of your body share some of the same nerve pathways. Because of this, your brain can sometimes have difficulty identifying exactly where the pain is coming from. Doctors call this referred pain. For example, some people visit the dentist because of severe jaw pain, only to discover they're actually having a heart attack. Others think they strained a shoulder muscle after carrying groceries. In reality, the pain is coming from their heart. If arm pain, jaw pain, or shoulder pain appears together with chest discomfort or shortness of breath, seek emergency medical care immediately. Don't try to drive yourself if the symptoms are severe. Call your local emergency services instead. Number 3. Shortness of breath. Have you ever climbed a flight of stairs and felt out of breath? That's perfectly normal. But imagine feeling breathless while sitting on the couch, walking across the room, or performing activities that normally don't make you tired. That's different. When the heart becomes weak because it isn't getting enough oxygen, it can't pump blood efficiently. As a result, blood may begin backing up into the lungs. Fluid starts collecting inside the tiny air sacs where oxygen normally enters the bloodstream. The lungs suddenly have to work much harder. That's why you feel like you can't catch your breath. Some people notice shortness of breath before they ever experience chest pain. Others experience both symptoms at the same time. If you suddenly become unusually breathless without a clear reason, especially if it's accompanied by chest pressure, sweating, or dizziness, don't ignore it. It could be your heart asking for help. Number 4. Cold sweat. Have you ever suddenly broken into a cold sweat even though the room wasn't hot? Your skin becomes pale, your clothes become damp, and you feel clammy for no obvious reason. This is another classic warning sign. When blood flow to the heart suddenly decreases, your body enters emergency mode. Stress hormones like adrenaline are released into your bloodstream. These hormones prepare your body for a crisis. One of their effects is triggering heavy sweating. This isn't the same as sweating after exercise or because of hot weather. It's a cold, unexpected sweat that often appears together with chest discomfort or nausea. Many heart attack survivors later say, "I suddenly felt something wasn't right." Listen to that feeling. Your body often knows something is wrong before you fully realize it. Number 5. Nausea, indigestion, or stomach pain. Here's a symptom that surprises many people. A heart attack doesn't always feel like a heart problem. Sometimes, it feels like a stomach problem. You may suddenly feel nauseated. Your stomach may become upset. You might experience heartburn or a burning sensation in your upper abdomen. Some people even vomit. Because these symptoms are so similar to indigestion, many people simply take an antacid and go back to what they were doing. But if the symptoms are actually caused by a heart attack, every minute you wait increases the amount of damage to the heart muscle. So why does this happen? The heart sits close to the diaphragm, and the nerves supplying the heart overlap with nerves that serve the upper abdomen. Because of this, the brain can misinterpret the source of the pain. Instead of recognizing that the heart is in trouble, it interprets the signal as stomach discomfort. This is especially common in women, older adults, and people with diabetes. If you've never had severe indigestion before and suddenly experience it along with chest pressure, shortness of breath, sweating, dizziness, or pain spreading to your jaw or arm, don't assume it's something you ate. It may be your heart sending an urgent warning. Number 6. Extreme fatigue. Everyone feels tired from time to time. Maybe you stayed up too late, worked a long shift, or didn't sleep well. That's normal. But the fatigue associated with heart disease is different. Imagine waking up after a full night's sleep, yet feeling completely exhausted before your day has even begun. Simple activities like making breakfast, walking to the mailbox, or climbing a few stairs suddenly leave you feeling drained. Many people describe it as if all their energy has disappeared overnight. Why does this happen? Your heart is responsible for pumping oxygen-rich blood to every organ and muscle in your body. When the heart isn't pumping efficiently because one of its arteries is becoming blocked, your muscles receive less oxygen. To compensate, your body has to work much harder to perform even simple tasks. The result is overwhelming fatigue. In some people, particularly women, this can appear days or even weeks before a heart attack. That's why persistent, unexplained fatigue should never be ignored, especially if it's new or accompanied by other warning signs. Your body may be telling you that your heart is struggling. Number 7. Dizziness or feeling faint. Have you ever stood up and briefly felt dizzy? That can happen if your blood pressure drops for a moment. But during a heart attack, dizziness occurs for a different reason. If the heart cannot pump enough blood, less oxygen reaches the brain. Without an adequate blood supply, you may suddenly feel lightheaded, unsteady, or as though you're about to faint. Some people describe the room spinning around them. Others feel weak and unable to stand. If dizziness occurs together with chest pain, shortness of breath, cold sweating, or nausea, it should be treated as a medical emergency. Never try to wait it out. Your heart could be losing precious time. What should you do if you think someone is having a heart attack? Recognizing the symptoms is only half the battle. Knowing what to do can save a life. If you or someone around you experiences chest pressure lasting more than a few minutes, especially if it's accompanied by pain spreading to the arm or jaw, shortness of breath, cold sweating, nausea, or dizziness, call your local emergency medical services immediately. Do not wait to see if the symptoms improve. Do not try to drive yourself if you're experiencing severe symptoms. While waiting for medical help, remain as calm as possible and avoid unnecessary physical activity. Quick treatment can restore blood flow to the heart and significantly reduce permanent damage. Remember this simple phrase: time is muscle. Every minute that passes without treatment means more heart muscle may be permanently injured. The sooner treatment begins, the greater the chance of survival and recovery. My final message: heart attacks don't always look the way they're shown in movies. Not everyone suddenly collapses. Not everyone experiences severe chest pain. Sometimes the warning signs are subtle: a strange pressure in the chest, pain moving into the jaw, unexpected shortness of breath, cold sweating, persistent fatigue, or sudden dizziness. These symptoms may seem small on their own, but together they can signal a life-threatening emergency. Learning to recognize them could one day help you save your own life or the life of someone you love. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and share this video with your family and friends. You never know who might need this information today. Thank you for watching, stay safe, and I'll see you in the next video.